Welcome to Parent Squad. When it comes to parenting, the focus is on helping our children grow into good humans. But while we do that, it is easy to forget that we too are getting older, and so are our parents. So what happens when the parents become the ones in need of care? We're here today to talk about caring for aging parents as Franciscan Health Geriatrician Dr. Kevin McNulty and Lisa Schneekloth, who is from CICOA Aging and In-Home Solutions. Thank you both for being here.
Thank you for having us.
Yeah, this is an important topic because I think a lot of adults end up finding themselves, you know, you're reaching a hand out to the younger people in your family and the older people in your family, and you can find yourself stretched thin, especially if you don't know where to find resources or how to navigate this chapter of life. So let's actually start with some of the basics. What are the signs, Dr. McNulty, that we should be looking for as far to know when our parents, our family members need help?
One of the big things is visiting them, seeing them in person, coming to their home. Are they keeping up with their day-to-day chores? Is their food in the refrigerator not gone spoiled? Or is there hygiene? Are they keeping up on that? Those are usually the earliest warning signs that those activities that we always do for ourselves, we're starting to struggle with.
Okay, and this can be a difficult conversation to have. I have had these conversations. Both of my parents have passed now, but it can be difficult to have because I know that at times it felt like we were prying, at times it felt like we were accusatory, and it was just difficult to navigate it. Do you have any advice or tips to how we can at least get the conversation started?
It's really, really challenging, and I would encourage everyone to have this conversation with your loved ones, no matter your age, because while Americans are generally a very optimistic culture, well, that will happen to someone else, not me. But we always need an emergency backup plan, and we need to think about that. My wife is abundantly clear what I want if I can't speak for myself, because of what I do for a living. But a lot of people don't have that conversation. So the first thing I would encourage is for the parents to start the conversation with their children and talk about that. But also the most powerful thing you can say is, I am worried.
Okay, and that sounds like it's really being honest, open, and somewhat vulnerable. And then another, well, we'll get to that in just one second. But I'm also thinking, well, you mentioned cultures. I wonder why we're not having that conversation, because in my own experience, I found it frustrating because my parents also went through the process of having to bury their parents. And I'm like, well, why didn't we have more conversations about this? Any advice for, I guess, just trying to steer the conversation of the end of life process, to talk about the end of life process?
Yeah, it's a very challenging and difficult thing because we didn't grow up having those conversations. It's not a normal part of our culture. There are resources that can help us with it. There's something called patientprioritiescare.org, which really helps walk through this process with patients. Is their care in alignment with their goals? What are their goals? What matters to them? That's the key to geriatric medicine. As we age, we tend to get more complicated. We get more medications, more doctors, more pills, more burden of disease. But how's that affecting our day-to-day function? And there are a lot of resources available to help people.
Well, let's get to Lisa Schneekloth, who is here from the CICOA Aging and In-Home Solutions, because I think this is a big part of the conversation, because I feel like the older generation has a picture of how aging goes, but today there are many more resources available and options available to that aging population, which I think is wonderful. How do we bring that in and try to bridge that gap? Because there's a lot that's in between full independent living and a full nursing care situation. There's a lot of gray in between now. And how do we, I guess, connect those dots to that generation?
Yeah, that's a great question, and it is a hot topic. And at CICOA, our focus is on education, and so we want to make sure that the individuals that are taking care of their loved ones know about us before they need us. So just knowing what resources are available is super helpful. And then as far as the the older folks, the ones that need the help, oftentimes we will get calls from them because they've seen that their neighbor has a certain service like home delivered meals, or they saw a community health worker going to the home to visit their neighbor and really wondered, if they might, be able to participate in that too. But we have a whole array of services, and at CICOA, we focus on what the individual and the family needs for them. It's not just a one cookie cutter type of service. It's a personalized care plan, and it allows the family member, especially the ones, if it's a career child, like the ones of the sandwich generation, so they're taking care of their children, they're going to work, they have a career, and then they're taking care of their parent as well. So we like to be sure that they have knowledge of all the services available, which include caregiver supports, one-on-one caregiver coaching for them that helps relieve that burnout. We tailor this around the time that they have available, because they may only have 30 minutes at 7 o'clock one evening because they're so busy with their children and their parents. So going back to education and knowing CICOA before they need the services, I think is key.
Okay, I love that you say it's not a one cookie cutter fits all, that you're really asking the probing questions to try to figure out what this family needs. What are the options when it becomes clear that a parent can no longer live alone?
Yes, so that would involve a call to our Aging and Disability Resource Center, and that the individual can call. We will have someone come out to the home if that's what they desire, as far as looking for the in-home services. We have private pay options that would allow us to come out. We have sliding scale options that would go out to the home and determine if, what the situation is, because actually sometimes families think that it's time for the loved one to go into a facility, when in actuality we can modify the home and make those tweaks with the bathroom or the handrails getting in and out of the house, that kind of thing, to extend their quality of life longer at home. So even when they think they might be to that point, we like to say, of course, talk with their geriatrician, and then also reach out to CICOA, because we can talk about a number of alternatives before they take that step to a facility.
Oh, go ahead.
No, I'm just saying we also would focus on fall prevention, checking the home for fall hazards and things like that. So I think, and sometimes a caregiver may just be burnt out and need that support, that encouragement, that one-on-one time. And CICOA can also do that. Yeah,
someone that understands. It can be a lot being a caregiver, certainly to someone so close to you that means so much to you. We mentioned, having someone step in, or having, I don't want to say that, transitioning out of your home and getting to some sort of assisted living facility. But there's steps that come before that. And I know you mentioned, Dr. McNulty, what to look out for when things might be a little bit off, but how do you know when you have to do a full step in and this is not okay, this is not safe? You have to draw the line at some point.
The most important thing is to keep our loved ones safe wherever they may be. So as a geriatrician, I primarily care for people with dementia. The vast majority of people with dementia do reside in the community, not in nursing homes or memory cares. But what they need is a wraparound support to help keep them there. The family, it really takes a village. We need organizations like CICOA's help to do this. We need oversight. There are medication dispensers with alarms on it that can help improve their compliance with medications. Daily check-ins. Does it have to be by one person, nor should it just be one person? People in your religious institution may be able to help. Neighbors can really step up. I have seen remarkable patients with a huge support of family or friends. There's adult daycare centers. There's all kinds of resources available to help people, but we really need to initiate it early and plan early as well. And that includes for individuals of sound mind. I live in a tri-level house. As soon as I moved in, I told my wife, when we get older, we have to move. There's stairs everywhere. We're gonna need to move to a single level where we can age in place, because that's our goal.
Yeah, that can certainly be a difficult conversation. So when we're talking about, you mentioned dementia, what's the difference, or when do we see concern between forgetfulness, because we know that there's a certain level of forgetfulness that just comes with age, forgetfulness versus cognitive decline?
Yes. So really the best way to assess it is what's the individual's function? Are they having a change in their day-to-day function, things they have always done that they're struggling to do? And then to get a standardized cognitive assessment completed, because that is how we really evaluate. You can't just guess at it. You really have to do an evaluation and talk about your concerns with the patient's primary care provider. Is the first step to that we're concerned about that, and then they can do a screener or a cognitive assessment and then refer to someone like myself or a neurologist for further evaluation.
Okay. And then you touched on it a little bit, Lisa, just some of the options available. Can we give the audience an idea of some of the options available between no care and then full-on daily care? I know that there's so many more things and that people can take advantage of now in this day and age than there were years ago, because we have this aging baby boomer population.
Yeah, absolutely. And it's so much more economical. It makes more economic sense to age at home. And they want to age in place anyway, so it's a win-win if we provide those home and community-based services to keep the individual at home. Some of those services would include home-delivered meals. It would include homemaking, somebody to come into the home and help them with daily functioning, bathing, dressing, housekeeping, those types of things. And then it would also help them, to live with more dignity of life for a longer period. Some of the other services that we could provide, like I'd mentioned earlier, would be the caregiver support or referrals to assisted living facilities instead of that big step to a nursing facility type of thing. Mm-hmm. So there's all kinds of options, and I think it depends on the individual situation and what would work best for them.
Mm-hmm. And I like what you talked about, Dr. McNulty, with getting neighbors, mm-hmm. church community. That's what's missing in today's society, is that community. People live next door to folks and mm-hmm. don't even really know them, don't really know their names, and that's so tough.
Yeah, and this is Older Americans Month, so we definitely encourage everyone to check on your neighbors, check on your loved ones in the family. This is a time to learn more about what they're doing, what their contributions are, talk to them about what they used to do, and what needs they might have. So May is a great month to recenter and really, be thinking about our older population.
Yeah. And then do you have any advice for planning how to pay for some of these options? I know this might cross a little bit into estate planning, but what can be done to try to help bolster families and get them in a good position?
Yeah, that again would be an individual assessment. There are services that we receive state funding for that we could help families out with as far as providing those services in the home. If individuals are at an income level that they don't qualify for those public funds, then we have private pay options for case management, and that's where we have a certified case manager walk alongside the family, holding their hand for as long as it takes to make sure they have what they need to keep their loved one at home for as long as possible. And that again helps to fill that gap, relieves some of the pressure of the caregiver, and then can also, and it's very affordable. So there are many options. We can bill Medicaid for certain things, or Medicare can get involved. So it's just whatever that individual and that family needs that fits their situation.
And then another big topic is driving. How do we know when we need to wave a flag about that, or to make that a bigger concern than what it normally is?
It's a huge topic and a huge area of concern, because here in Indianapolis and the surrounding counties, we really do rely on our motor vehicles, and that is a huge part of our independence, which is what older adults want to keep. They don't want to often rely on other individuals, and the car is the biggest thing. However, we also have to keep our loved ones safe and other people in the community safe. So the biggest red flag is a ding or an accident that they don't know much about. Getting that evaluation, getting their physician to do that cognitive assessment and talking through about, okay, what are the other options if we cannot keep driving so we don't get isolated, because loneliness is a huge risk factor to develop dementia. So there are things like go-go grandparent, for instance, and other transportation options that I think Lisa can speak to.
Okay. Yes. Lisa, I'm sorry. I was stuck on go-go grandparents because I was like, oh, that's a really cute name. But are there some other options that you come across?
Yeah, so again, a call to CICOA's Aging and Disability Resource Center can walk the individual through all the transportation supports that are out there. There are some that can bill Medicaid. There are others that provide direct services through private agencies. And we're all about making sure the individual stays connected. So I did want to mention that one great option is our congregate meal sites. So individuals come together and have a meal, a lunch time, 5 days a week. It gives them an opportunity to socialize, to play games, and just to have a nutritious meal with friends so that they can stay connected, because it is a really big part of staying alert and taking care of ourselves.
Okay. All right. We have a doctor here as well as an expert on care options here. And what I hear you saying is to really to really ask questions and to be persistent and to try to find what resources are out there and not to be shy about it. So we appreciate both of you all for being here. We have more info on our website that can connect you to some of these resources at WTHR.com/Parent Squad. Thank you.
Thank you.
Thank you.